Hi everyone, I am delighted to be joining you at your webinar this afternoon to bring you through the research we did at Dublin City University, which was funded by the National Disability Authority. So my name is Mary Rose Sweeney, and I did this research with my colleague Dr. Bridget Casey at DCU, and also with Dr. Andrew Boylston, who's also from the School of Nursing at DCU, and Alistair Churchard from the University of London in the UK. So the study was looking at the whole idea of autism and homelessness, and we had some really good partners in this research. So we partnered with Michelle Connolly and Magella Darcy from the Dublin Simon community, with Sarah O'Gorman from the Dublin Regional Homeless Executive, with Gavin McGranahan from As I Am, and Dara Byrne from Gale Services. Lucy Whiston and Sophia Kilcullen were our partners from the PPI Ignite project at DCU, and Desmond Murphy and one other PPI contributor who wishes to remain anonymous were also partnered with us on the research. So we had a great team starting out. So most people on this call will probably know that autism is a developmental disability that affects how one relates to and communicates with other people. And sensory overload is a very significant issue for this population as well. So the most recent prevalence estimates for Ireland and internationally are thought to be in the region of 1 to 50 to 1 in 100 people. That was a DCU study we conducted a number of years ago, that prevalence estimate, which agrees with international estimates. And so adults with autism are at considerably higher risk of poorer outcomes, including, there's more likelihood they will suffer social isolation, discrimination, victimization, and difficulties even in attaining and maintaining employment. Often they are underemployed, and also they experience issues with, seeking and securing housing and obtaining and securing independent living. So just to mention then, the other area we were looking at, sorry, I have to keep moving this around because it's getting in the way of my slides. So homelessness is a global challenge, and it can result from a range of socioeconomic factors such as poverty, again, those issues around employment, discrimination and stigma, and also often personal issues such as physical or mental disabilities, addiction or relationship breakdown can all contribute to a situation of homelessness. The recent government figures we have in Ireland estimate the number of homeless adults to be around 6,000. But of course, we know that's a minimum estimate, as there are many people living in situations of hidden homelessness as well. So the relationship between homelessness and autism is fairly underexplored in research terms. But there is emerging evidence that people with autism are overrepresented in homelessness. And this research evidence mainly comes from a recent and very robust study from the UK led by by our co-investigator Churchard et al., which was published in 2019. And that group estimated that the prevalence of autism among a cohort of long-term homeless people in the UK was in the region of 12%. So you can see straight away that's a lot higher than the estimate we have for autism in the general or the housed population. But we have no previous study or no evidence emerging from Ireland which has explored this in this context. And it's probably worth mentioning as well that autism prevalence estimation is notoriously difficult, even in a stable or a housed population. So you can imagine the challenges in trying to get a prevalence estimate in a homeless population. So we set out then with three broad aims at the outset of the project. We wanted to estimate the number of people who have autistic traits in a representative sample of homeless people based in Dublin. And that was how we were going to capture a measure of autism prevalence, because obviously, we weren't going to get these individuals into any kind of a clinical multidisciplinary assessment setting. So this was how we were going to approach this study. We wanted to explore the lived experiences and perceptions of homeless service provision in a small group of adults with autism who have or are experiencing homelessness. And we also wanted to look at the people the key workers and the service providers who provide services in a homeless context, to see what they knew about the needs of people with autism, and also to explore their own needs in relation to training and knowledge acquisition to help them to optimally provide services for clients with autism. So I suppose there were a number of methodological considerations at the outset. One was that we were, of course, concerned about, potentially doing some harm while doing this research. So we were worried about involving individuals directly in the research if they had never previously thought about the fact that they might have autism, and we didn't want them to be worried about it. So that raised some ethical issues for us. So that's really the main reason why we decided to go with that, coupled with the fact that they are a hard to reach population. We decided to adopt the approach used by Churchard et al. in the UK, and that was a proxy-informed approach where key workers completed screening instruments on behalf of all clients in their caseload. So they were completing the information by proxy. So the first study then was the prevalence estimate. So Dublin Simon key workers completed a researcher-administered screening tool on behalf of all clients in their caseload. And this screening tool was, the abbreviation there is the DAHI survey. And this was developed by the UK team that I mentioned. And it really explored the absence or presence of certain autistic traits. And they're listed below there, but in summary, exploring deficits in sort of communication, in socialization, in developing, understanding and maintaining relationships, whether there was the presence of stereotypical and repetitive behaviors, whether there was an insistence on, very strict adherence to routines and, very fixed interests, and whether there was, a sensory overload issue present. So key workers were based in settings which were representative of a range of services provided by, of the full range of services, I should say, provided by Dublin Simon services. And they included emergency accommodation, supported housing, and treatment and recovery. And we invited all 14 key workers who worked in one designated area of Dublin city centre to take part. And that was in an effort to be as representative of a given population as possible. So the second study then, we were looking at the lived experiences of individuals who were experiencing homelessness and also who self-identified as having autism. And they were recruited via their key workers. So we used a narrative interviewing method to get the participants to share stories with us about their perspectives of autism and homelessness. And the data was analysed then using the Reisman's narrative analysis to construct an overall, to capture the overall trajectory of their life. And then this was further analysed to result in the generation of common themes. And the third study then was a practitioner knowledge and skills. So it was an online anonymous survey which was circulated via Qualtrics, which is an online platform we use at DCU. And it was disseminated to key workers working in Irish homeless services. And it was sent to about 1,000 individuals to explore key workers' self-perceived knowledge of autism and their own training needs, to look at their perceptions of the strengths and needs of people they provide services for who have autism or are autistic, and to look at their experiences and opinions regarding the level of quality of service provision for autistic adults provided in Irish homeless services, and also to explore their recommendations. So, of course, prior to all of this, we obtained research ethics approval from the committee at DCU. And of course, the pandemic struck in March, right in the middle of data collection. So we had to submit an amendment to approve the online collection of our data through Zoom. And so that was both for the prevalence study, which around 40% of the data was collected by Zoom, and also for the narrative interviews.
Hello, I'm Breach Casey, and I'm going to talk you through some of the results from the studies, from the 3 studies, and the conclusions that we came to as a result of the research, and the recommendations that we'd like to make in relation to the study. So I'm going to start off just talking, first of all, about study 1, which was a prevalence study, and our results from that show that the key workers, first of all, they completed questionnaires on behalf of 106 clients. 83 of those were males and 23 were females. And they were from a range of services, as you can see there: emergency services, supported housing, and treatment and recovery services. From that, the prevalence estimate was achieved, and we can see that out of the 106 clients included in the screening, 3 people, that was 2 males and 1 female, screened present for autistic traits, and that gives a prevalence figure of 2.8%. A further 7 clients, which are 6 males and 1 female, screened as possibly present for autistic traits, and that gives a total prevalence estimate of 9.4. In relation to study 2 then, which was the study that incorporated the views of service users, people who had autism and were homeless, there were some very interesting findings there. First of all, participants experienced autism in the midst of a range of other complexities. For example, adverse childhood experiences, trauma, bullying, family issues, and also social issues as well. For example, stigma, shame. They also experienced neglect and ignorance from the general public and even within their families. They find the psychological impact of having autism particularly traumatic. They hadn't been diagnosed at an early age. Sometimes they weren't in a position to be able to understand their behaviours, or nor did their family from time to time. And so this contributed to lifelong disruptions to their identity, their sense of belonging, and the sense of an inner home where they felt at home and comfortable with themselves, because they had, kind of great difficulty in coming to terms with why they were or how they're different from other people. A lot of distress around not being diagnosed at an early stage in their lives and have been helped to understand their ASD, and they believed that this compromised their mental health. Another issue was co-occurring addiction issues, mostly because of the stress and alcohol amongst these 3 participants was used very much as self-medication, and helping them to mix with others, almost as a social lubricant, so to speak. They also experienced challenges in accessing appropriate homeless services. And for this cohort, that include addiction services as well. Housing services were difficult to access and to enter, and there was very little support for their ASD needs. On being able to enter services, often the services were perceived as crowded, threatening, and chaotic. And the participants identified a lack of autism-friendly facilities. They had communication difficulties, and they perceived a lack of autism sensitivity or awareness amongst staff. And the addiction services proved particularly challenging, especially where they were based on group participation. And the clients in this study find that really difficult. And you can imagine some of the challenges there, especially someone who has autism trying to talk about their feelings and their experiences within a group context. And especially when they would have had experience in the past of peers bullying them, they find that extremely challenging. And when we move on to study 3 then, which is in relation to practitioner knowledge and skills, we had 206 responses there, and some very interesting findings there too. 85% of the respondents to the survey said that they had no formal ASD training, and 65% identified as having a lay person's knowledge about autism, and that actually was borne out in the findings, because we could see from their responses that they had quite a good knowledge regarding common autistic traits, but the knowledge in relation to specific challenges and comorbidities amongst people with autism, for example, mental health issues or trauma, vulnerability and addiction, that was much lower in terms of the knowledge level. And, you know, it's okay as a member of the general population to have a layperson's level of knowledge, but for practitioners in homeless services working specifically with people with autism, we would expect that they would have a more advanced level of knowledge and skills. Interestingly, the participants, the key worker participants, also identified themselves as having quite a low level of knowledge in this area. So they recognized that their skills were limited, and they felt underconfident or lacking competence in relation to areas of assessment, communication, and just understanding the more specific needs of people with autism. And that transferred into their work then as well, and they highlighted challenges in accessing screening and diagnosis for adults with ASD. So that's an added challenge in relation to, in addition to their own lack of knowledge. The majority, as you can see there, reported that there were no specific interventions or arrangements for people with autism within their services. And 80%, which is quite a high figure of respondents, felt a really strong need for autism-specific training. So when we think of those various results and findings, that leads us to some of our conclusion points, really. That, well, first of all, our prevalence rate of 9.4, it's high, but it's still lower than our report, a UK study by Churchyard et al. And Alistair Churchyard was actually involved in our study as well. But their study, the UK study, was 20% estimated prevalence. Now, the UK study had a different cohort, and they had a different profile. A lot of those service users, well, they weren't particularly service users. They had difficulty engaging with services, but they were much more entrenched in their rough sleeping, and they had been homeless for a much longer period of time. Whereas the Irish sample were accessing services, and they were much more stably housed. So there was a somewhat different population. But it is important to remember that, or to note that even at that, the prevalence rate are still considerably higher than in the general population. I mean, the rate amongst the general population is 1%, whereas our research shows that it is 9.4 amongst people who are homeless. So that does lead to the conclusion that people with autism are overrepresented in the homeless population, and that autism is a risk factor for entry into homelessness and an added challenge to exiting from homelessness. We have already identified that homeless adults with autism experience comorbidities and challenges. We mentioned trauma already, mental, physical health issues and addictions, as well as social and health marginalisation. And that a lot of these characteristics and support needs are not recognised or addressed in housing policy, strategy, or housing support provision. Early diagnosis of autism remains inadequate, and screening support and homeless prevention and intervention among adults with autism is quite poor. And that was revealed across the three studies, really. And interestingly, in the third study, practitioners in homeless services feel challenged in addressing the ASD specific needs of this population, and they've voiced the need for training in order to provide that skilled intervention. So from that, we would recommend that there's increased investment in diagnostic training, services and support for autism in childhood and adolescence. And this is a form of primary prevention. If people get the support that they need, they're less likely to experience social health difficulties later in their lives. And that's well borne out by research and supported by research. In terms of adults then, that we need to undertake further validation studies of screening and diagnostic tools so that they are really fit for purpose. And as well as that, to develop a range of diagnostic tools to suit varying autism populations and those with comorbidities, because not one size fits all. And there's various things that need to be taken into consideration if someone has an accompanying, addiction or mental health issue. So that people can get properly screened and properly diagnosed. And this extends as well to key workers, because obviously we have very few screening services in the country. So as a first step, if you like, it's not suggested that this would replace proper diagnosis, psychological diagnosis. But if there were basic screening tools that can be used by a range of practitioners, so that people with autism can at least have their needs recognised and met to some extent. There are good examples of these screening tools that can be used by practitioners. For example, screening tools for depression and low mood, for example. So work could really be progressed in terms of developing these screening tools for autism as well. Ensuring clear pathways to diagnosis and service provision for adults with autism through appropriate referral pathways. And I mean, that goes not just for people in homelessness, but across the population. Developing evidence-informed primary, secondary and tertiary prevention of homelessness amongst autistic populations. And this is very important. I already mentioned early diagnosis in childhood or as youths could be a really strong measure of primary prevention. In terms of secondary prevention, people who may be at risk through maybe family breakdown or parents not being able to cope, or other kind of, employment or education breakdown, that services are able to intervene and prevent homelessness as a result of that. And for people who have become homeless, who have autism, a range of supports to help people to be able to exit homelessness quite quickly and effectively. Identifying and accessing barriers to support service for people with autism in terms of addiction, comorbidities and homelessness. And that's really important to be able to preserve people's health and social function. For that to happen, we need to develop cross-disciplinary models of support and provide specialist services for people with autism where appropriate. For example, mental health service and addiction services. And that's, again, regardless whether person is homeless or they're stably housed. But particularly in homelessness, this has been a very strong finding in this study. The HSE and other bodies need to undertake review and development of autism policy in collaboration with the relevant services and stakeholders. There has been some good work done in relation to autism and disability policy development, but in particular in the context of homelessness, that could be advanced much further. To increase investment in autism-friendly environments in homeless services. Again, there's a lot of work to be done there. And in terms of the both the policy development and developing autism-friendly environments. There's a lot of really good work has been done in the UK and in Europe that would serve as really good models in terms of autism toolkits, of guidelines for making environments autism friendly. So there's a lot of work, and indeed there has been work been done by people on this study, Mary Rose Sweeney and Andrew Boylston, in terms of autism friendly environments. So we have got some good guidelines that we could follow. Supporting the development of relevant practitioner skills and evidence-based approaches and interventions. And this came across as one of the strongest recommendations really in the study, and coming directly from practitioners themselves. At the moment, we do have an undergraduate certificate in homeless prevention and intervention running in DCU, and we do look at people with disabilities and the interaction with homelessness. But, on foot of this study, we'll obviously be looking much more closely specifically at autism, but that may not be enough. We obviously need to look at rolling some kind of support and education out across services, and also developing autism training for all social and healthcare employees, to ensure effective interdisciplinary working, whether that's someone working in a housing agency or directly with people in a whole range of health and social services, to improve understanding and that people get referred to appropriate services. So I'm going to hand over to Michelle Connolly now from Dublin Simon, who'd like to say a few words. Thank you very much.
Hi, I'm Michelle. I'm the Research and Advocacy Officer with Dublin Simon Community. For my presentation, I'm just going to take you through what I feel are the most important points for the homeless sector to take on board. I think one of the really positive aspects of this study is that a lot of the recommendations are very feasible and very practical and will go a long way to making our autistic clients feel a lot more comfortable and supported in services. As a whole, it was an absolute privilege to be a part of this project. It was as rewarding as it was challenging to get it over the line, given the year that we all just had. But I'm really delighted to be an early contributor to research in this area, and I'm really looking forward to seeing the work and the conversations that develop as a result of this being published today. I think the study is really important in that it highlights the high presence of neurodiversity in the clients that come through our doors every day. It really emphasises the importance of listening to and learning from the experiences of autistic people in our services, but it also gives great insight to the staff who care for them and how well equipped they feel they are to do so. Just on the back of the recommendations that my colleague Breed has already highlighted, I'm just going to talk through kind of 3 or 4 points that I feel are very practical and very feasible, but also just very important for the homeless sector to continuously bear in mind and to continuously implement in our services. First off, I suppose the most striking thing for me was the overlap of experiences of people who are autistic and people who are experiencing homelessness. And then when you are someone who is autistic and experiencing homelessness, there's just a massive level of challenges and barriers that you have to overcome just on a daily basis. I suppose separately, autism and homelessness can have a massive impact on the way you interact with the world and the way the world interacts with you. So in the homeless sector, we're constantly talking about addiction, mental health issues, experiences of childhood trauma, stigma, discrimination, barriers to work, barriers to education, and a lot of those things, if not all of those things, are very common to autistic people as well. So when you are both autistic and experiencing homelessness, the importance of the service that you're in being able to cater for your complex needs or whatever comorbidities might arise can't be understated. And again, it comes up again and again and again, the importance of trauma-informed care for homeless services. And again, this research is no different in that respect. The second point that I'd like to highlight is something that we're all very conscious of, but again, I just don't think it can be emphasised enough. The impact of homelessness in itself and the homeless system on an individual. Homelessness in itself is a massive trauma. The homeless system can sometimes be difficult to navigate, and the whole thing can just seem really, really overwhelming. Services can be very busy, and I'm thinking, like, if you can imagine being in a shared room with 3 or 4 other people, in some instances there's just a massive amount of stimulus and you've no privacy, you've no control over your environment, and that's just a really overwhelming and difficult environment for an autistic person to operate in. So again, we really see the need for single unit emergency accommodation and a move away from that shared dormitory style accommodation. The third point that I'd like to highlight is the need for targeted prevention services for autistic people. They've been highlighted as an at-risk group for experiencing homelessness, and having targeted prevention services that can intervene before they have to enter the system at all is probably one of the best methods we have of safeguarding the group. And then the final point that I'd like to emphasise is the point that Breed raised around awareness and training for staff, just so that they feel prepared and equipped and supported to support any client that comes through the doors, no matter what their support needs are, whether it's mental health, addiction, whether they're autistic, or whether it's any combination of all of them and any other support need that might arise for them. Having well-prepared, sensitive and accessible staff is probably one of the best supports that we can offer for someone who comes into homeless services. I'd just like to say thank you very much for your time, and I'm going to just hand you over to the next speaker. Thank you very much.
Thanks, Michelle, for your interesting contribution. And now I'd like to introduce our final speaker for this session, and that is Desmond Murphy. Desmond was a peer researcher on the project and is someone who has autism and has had experience of homelessness. Desmond provided really useful insights and contributed to our study to a huge extent. So we're delighted that he's able to speak a few words today. So it's over to you, Desmond.
Hello. Hello, everybody. I'll just read it. I've enjoyed myself taking part in research, which will hopefully be useful for all those who have autism and who are homeless. As someone who has autism and has had a lot of experience as a homeless person, I have provided some of my thoughts and opinions on this topic below. In relation to autism diagnosis, this report is based on autism and homelessness. It is in my view and experience that many on the spectrum who are homeless have learned how to survive from going through life's hardships and can function well. Therefore, there's a high rate of autism which is under-recognized, which is in my view, my own discernment. There are high amounts of autistic people who are rough sleepers, in hostels, or sofa surfers. What's important is that, to me, which is important in my own experience, this is that hostel managers grant permission to key workers to discern that they may have an undiagnosed client with autism. With this in mind, there should be a funding, or, bear with me now, whatever the HSE could provide, to get the client to test for Asperger's. In that event, it could serve or save the client years of homelessness. To live as an autistic child, adult, in a non-autistic world, and to survive is a great achievement in itself, not just for me, but all those who survived, from an autistic background. Autism and homelessness. I sensed many became homeless as their parents could not cope with their extreme behavior. And as a result, an autistic person has to survive on the streets. In many ways, they cut themselves off from society. So many young people with Asperger's would be fearful in entering a hostel for the first time, and more than likely thereafter. It would be a personal out of bounds to many on the spectrum. Therefore, I would say it's possible to assume that fear of one's safety could be the main contributor as to why so many Aspies are rough sleepers. And I think there'll be a lot of more research as well on this one. Many of those who try to fit in just become puppets. For those who are victimized or those who have been bullied, I so believe that many people with undiagnosed autism find themselves in sort of places and used by drug dealers and other forms of depraved deviation. Many have been abused by such undetected criminals, and the crimes on such people go unnoticed. Many autistic adults, particularly young adults, have turned to drugs when they were rejected from the family home and found themselves on the streets. Autistic adults who are drug and alcohol users do not respond to treatment in the ways that the civilian addict world would. My own recovery was long and painful. I found it hard to grasp the recovery method that I sought. However, recovery comes through perseverance, which autistic people can be gifted with, and resilience seems to be another attribute. Key workers and service involvement. Regarding key workers' involvement with an Asperger's client, I believe it is imperative to understand that by and large, it's all black and white regarding the mindset of an autistic adult, and particularly young adults. Some flexibility may have been achieved with age, but to the younger ones, it can be extremely difficult for the client to understand, bear with me, changes of rules, routines, etc., in the hostel routine and everyday life. From my own experience, not just with me, but others also, there have been incidents where something was promised or offered to be done and then fell through, resulting in the client entering into tantrums. How can these barriers be overcome? Maybe the key worker needs to be deluded of certain aspects of their authority. My suggestion is that meetings with key workers, doctors, social workers are not subject to change or interrupted as far as possible. And that, I mean, these are not subject to closure or opened at unplanned times. If a key worker makes a mistake in relation to a client's welfare, should I succumb to the nature of the Asperger's mindset? This, I sense, is an area that needs balance for both parties involved. It's not ever going to be right. It's just like life itself. It's a case of learning from mistakes. However, with this in mind, I would ask staff to be mindful of our clients' needs and have empathy to their condition. One area I could be benefit to those on the autistic spectrum is that a counselling service be in action, as it is very expensive for individual therapy for autism. To sustain those who are vulnerable needs long-term goals, and those goals put into action with the key worker and clients, especially after identifying attributes and gifts with active engagement in hostile education and training. Thank you. It was a pleasure to be a peer researcher on the matter. And that's all I can say. Thank you all very, very much.
Thanks, Desmond, for your insightful comments and for reminding us all that at the end of the day, it's the service user experiences that counts the most. I'd like to finish up by thanking everyone who contributed to the presentation today, and particularly to all our participants in this study, service users and staff, and the various organisations that were involved both in our steering group and in the conduct of the research in bringing this to fruition. Thanks very much as well to the NDA for allowing us this opportunity to do the research. I hope that this research really contributes to significant change within the sector and more effective service provision and service planning for people with autism and homelessness contexts. Thank you very much. Bye for now.